I think targeting other pathways beyond JAK is critical. Which of them are the most impactful? We certainly have a sense of that. BET, PI3 kinase, the apoptosis pathway with BCL-XL, telomerase, HDM2, they all have a role. Will they all have an equal role in all patients? I suspect not. I suspect that we will learn more from correlative studies from this unprecedented period of multiple parallel phase 3s that will help us be more precise in terms of which combination we use for which patient. But I do think the maturation of the data from the phase 3s will really be critical for all of these studies, which really have been conducted in parallel for us to try to make the best decisions we can for patients.